Hi. For this week's video, we have with us Tony Kenya and Michelle Schrettengoss. Both are RNs and clinical leaders for Quality Life Services, and they're going to answer some questions that we have about PPE this week.
So, gals, there's a lot of talk about personal protective equipment shortages around the country, perhaps around the globe. Can you kind of enlighten us on QLS's current stock or supply?
Yeah, we definitely have enough supplies, but it's certainly not the time to let our foot off the gas either. I think, Tony, you can probably speak better to all the efforts that have been being made on a 24/7 basis to acquire this equipment.
Sure. Each day, Paul and I start our day with definitely getting on email and looking and touching base with our current suppliers. But then also our current suppliers have been really great about reaching out to us with non-traditional suppliers or somebody that they know. And we definitely reach out to them. We definitely have been ordering supplies from people that we've never heard of. But we are able to obtain the supplies through those methods.
Great. I might mention we've also had some people donate supplies, which has been wonderful. So it sounds like we have made a lot of progress in procuring PPE, but do we have enough for all the employees at every location?
Absolutely. At this point, we do. I think that there's a delineation between the supplies that we're using right now to protect ourselves as well as protect the residents. But then when and if we would have a COVID case, we certainly have those supplies available also. N95 masks, gowns, gloves, face shields. So yes, we absolutely do have enough supplies, but every day we are continuing to augment the supplies that we currently have.
Great.
And I think it's important to note that the difference between the daily PPE as opposed to the COVID PPE. And I know that we're constantly working to obtain more of both. And part of that is we do have enough, but we also have to be responsible about how we're using it.
Of course. So thank you for highlighting about some of the other pieces of equipment, because we do talk a lot about masks, but it's important to know we do have the gowns and we have the face shields and all those other things. Speaking of masks, I have heard that some of the masks, fabric masks, cloth masks, perhaps paper masks, were not necessarily recommended, or staff were discouraged perhaps from wearing them. But it sounds like the CDC has really changed their stance on that, which has been one of our primary sources of information. Can you talk about that for a moment?
Yeah, it does change daily, sometimes more than daily. I can say that I'm very comfortable knowing that our company is definitely at the forefront and on that. And that is why we change also. So as they learn about this virus, part of what the study is they're studying the spread of it. So they've determined that now with the spread of it, you could be a carrier and not know it. So that's why we're switching kind of gears to everyone masking, or the universal masking term. Is that the right term that you would use, Tony?
Universal masking, which is a recommendation. It has not been a mandated or a guideline, but it is a recommendation that each nursing facility wear masks at all times. If you are an employee who is taking care of a resident directly, you can wear like the paper masks that are supplied, but then also any employee that is not directly taking care of a resident, we are asking and have allowed that you can wear a fabric mask.
Okay.
Great.
Thank you for clarifying that.
So lastly, what about other kinds of PPE and infection control? Do we feel certain that we have what we need to prevent COVID-19 from entering our building or from spreading it within a building?
I absolutely do feel that we have enough. And in the event that COVID, does come to the home, I feel very confident that our employees and residents will be safe and that they have the supplies that they need to take care of the residents.
Absolutely.
Great. So we're good on hand sanitizer, hand soap, those kind of things, getting everybody to wash their hands.
Yeah, each of our administrators have actually reached out to their local Department of Health, and we just received a phone call today that we will be receiving additional supplies from them.
Great.
And one of the things that we keep reminding everybody is washing your hands is free, and that is the number one defense in stopping the spread and preventing the spread. So yes.
Great. Well, we thank you. We know that this is an ever-changing situation and that you two are on top of it. But you're not in this alone. There's a lot of people working on the front lines and behind the scenes to do whatever we can to protect both our residents and our staff. So thanks for joining us.
Thank you. We appreciate it.
Hello. That was great information from Tony and Michelle about our ongoing efforts and success in acquiring personal protective equipment. A huge amount of time and effort has been put into acquiring all the equipment and supplies that you need. I wanted to let you know about the efforts we're taking to ensure that we are implementing the latest recommendations and guidance from qualified sources. Numerous members of the leadership team participate in multiple daily calls, webinars, and live updates from CDC, CMS, and Department of Health, as well as our state and national associations. Our medical directors are also involved in regular updates with QLS and their own medical sources of information. It's important to note that we are not counting on social media and sensational news reports for our guidance. We rely on those that are most qualified to provide the information. However, I know many of you use social media in order to stay in touch with friends and family. I encourage you to follow Quality Life Services, PHCA, and AHCA on both Facebook and LinkedIn. There have been great information and encouraging posts. Additionally, watch the PHCA Cares and Healthcare Heroes trending hashtags to see what some of your coworkers and other long-term care locations are doing for each other and for those that we serve. There are weekly prayer and devotionals on the QLS intranet site by our own Pastor Amy Warline. I know that this time has been challenging and stressful for all of you, both professionally and personally. Thank you does not come close to adequately expressing our gratitude and appreciation for all that you're doing for each other and for those that we serve. Thank you and God bless.